Welcome back to the 14th Jaipur Literature Festival here at Digi Palace's front lawn, protected by Dettol. It's a pleasure to present The Vaccine and the Virus, a moving target. Amitabh Kant, Vinod Paul and C.K. Mishra in conversation with Sarah Jacob. The world's biggest inoculation drive against the novel coronavirus pandemic has begun with India's effort to immunize more than 1.3 billion people across the length and breadth of this country, including health workers, safai karamcharis, the army, the disaster management volunteers as a priority group. The country currently stands sixth in the world in providing vaccination coverage, and it is set to balance domestic requirements vis-a-vis requests pouring in from across the world to ensure that they too get the indigenously developed vaccine. An important panel on the path ahead, reviewing the past year and discussing strategies for public health mitigation measures, concerns about the newly discovered strains, effectiveness of the vaccines that we have right now, and the potential for economic recovery, and preparing for what will be a long battle against a very moving target. Amitabh Kant has been the former chairman and CEO of the Delhi-Mumbai Industrial Corridor Development Corporation, which was developed by the Government of India as a global manufacturing and investment destination supported by world-class infrastructure and enabling policy framework. He was also chairman of the Committee to Implement Digital Payments in India. He's presently CEO of the Niti Aayog. C.K. Mishra joined the Indian Administrative Service in 1983 after he passed out of the prestigious St. Stephen's College, and he then headed the Ministries of Environment, Forest and Climate Change. He used to lead the government initiative for air pollution mitigation in Delhi and indeed all pollution control strategies for the country. He was also the head of the forest and wildlife conservation efforts in India. Vinod Paul, a pediatrician by training, has been on the faculty of the Department of Pediatrics, All India Institute of Medical Sciences, New Delhi, and head of the department for nearly a decade. He chaired the Technical Advisory Group on Women and Child Health for WHO's Southeast Asia region. He's been a co-chair of the board of the Partnership for the Maternal, Newborn and Child Health. The Government of India appointed Paul as a member of the National Institution for Transforming India, the Niti Aayog, in August 2017, where he leads the health and nutrition vertical. Sarah Jacob is a journalist and senior editor at NDTV 24/7. She's the anchor of We the People, one of NDTV's flagship primetime shows. Previously, Jacob was the US correspondent for NDTV and covered both the 2008 and 2012 presidential elections. Please do remember to comment by typing it into the comment section below, and do pose your questions. Ladies and gentlemen, the vaccine and the virus, a moving target. Amitabh Kant, Vinod Paul and C.K. Mishra in conversation with Sarah Jacob. Sarah, over to you.
Hello and welcome, everyone. Sanjoy, thank you so much. A pleasure to be here at the Jaipur Literature Festival, albeit virtual. As usual, your topics are very well chosen, but the timing of this conversation also could not be better, because starting on Monday, India's COVID vaccination drive is going to open up for those who are over 60 and for those who are over 45 years with comorbidities. And this is going to be crucially, critically, importantly at both government and private hospitals. And this comes at a time when cases across India are on the rise. Since India's cases have begun to inch up, several states are showing a resurgence. Maharashtra, of course, especially worrying, seeing a spike in daily cases. I think over 8,000 cases on Wednesday. And so thank you for putting together this panel and picking this topic. But Dr. V.K. Paul, I want to start with you first. This decision, right, it's a significant opening up of the vaccination drive with a rollout for the general public now. And the date for that has been moved up. I think it originally was supposed to have been in mid-March. And it's coming at a time when there are some fears. There's a talk about India perhaps being on the brink of a second wave of infections. So this move, the significant opening up, it is timely, it is apt, it is the rapid ramping up of the campaign. That's the need of the hour.
Thank you, Sarah, and thank you, organizers. Thank you for the opportunity. Uh, I would basically like to start by saying that the plan to vaccinate a large population of India as a priority population is based on the principles that the world has followed and the people of India have accepted, namely, look after the healthcare workers and frontline workers because they are the ones who are protecting us from the current pandemic. They have done so far, and of course, they'll also protect us in future. That becomes the one of the key priorities, and we began with that. Then, of course, the logic is that you first and foremost make sure that those people who are vulnerable for severe morbidity and adverse outcomes, even mortality in particular, they should be protected first and foremost. And this is the way all the countries have gone forward, and this is based on the logic totally supported by our own science fraternity as well as the World Health Organization. So that becomes our first goal. In doing so, you're also creating, to an extent, herd immunity eventually to stop the chains of virus transmission. It'll happen side by side. And so that is our first goal to begin with. There is no surprise to the date in a way because we said the government had always made it clear that we'll begin with the first two groups, namely healthcare workers and frontline workers. And as the system settles and as we move into a stable vaccination program for these individuals, the other waves and other groups will be dovetailed, so to say. And that's what exactly is happening because we are ready now to move into a more ambitious phase where there will be a very, very significant escalation in terms of the number of vaccinees receiving vaccination on a daily basis. And we're now reaching out to general public. So the nuancing has to be very different. So far, we have been institution based, and these two groups are now being prioritized for action right away. Going up down to 45 years with comorbidities is also highly relevant because we don't want people with comorbidities to wait for too long. They are also the ones who suffer from severer forms of COVID-19. So it's a very rational, graded, proactive decision for us to move into this phase, and there will be then next phase, which brings in the remaining groups of the first wave of immunization.
When you look at the numbers, we vaccinated about 1 crore people, right? And faster than any country other than the US, the government tells us repeatedly. But the fact is that, we're also inoculating less than 2 lakh people a day. And Dr. Paul says that this is when we're going to see it being ramped up immensely. It's going to, really grow. But if looking at the numbers we had so far, that we've inoculated less than 2 lakh people a day, that's not going to allow us to reach our targets of 30 crore people by July or August. If you look at the numbers I was looking up today, it says, I think Israel, 80% or so, they do 80 people per 100. The United Arab Emirates, about 50%. The US and UK, maybe 25, 20. Turkey, Germany, Brazil. Then China at around 3%, maybe. And India at about 1%. So when you look at these numbers, what should one make of it? Look at the positives, look at the negatives, or it's a mixed bag?
Well, Sarah, we only have started the vaccination program. We have not yet peaked the vaccination program. And on a daily basis, the number that's being done is up to 4 to 5 lakh per day as well. And because we are dealing with specific groups, the planning was done in such a way that there is comfort, people are able to come out of their workplace and receive vaccination. So it was a group that was being targeted in a certain way. But now, when we are going into the more ambitious phase, be rest assured that this will be phenomenally higher. This daily number of vaccinations will be phenomenally higher. And I do agree that you are then talking about massive numbers, and to go to that kind of a number, 3 million, 4 million, even more, is well within the reach of India's health system, public in partnership with the private. It will be done. India will deliver on this. Remember, each year we give more than 65 crore, more than 650 million injections to babies and
Yes.
and mothers. We have that capacity. More than 9 million vaccination sessions are held. So it is in that sense a familiar ground. And we have the army of workers, an army of people out there to implement a program of such importance for the country. In a two mission mode, it will be possible. And that escalation you will notice by the day as we move forward.
Well, one of the positives, since I talked about positives and negatives, let me say the positive myself would be, I'm guessing as a doctor, that if you've inoculated 1 crore people, we haven't heard of deaths. No deaths have been reported. We've only heard of mild side effects. So perhaps that's one reason why you have to start this slow and then you can pick up. But Mr. Kant, Amitabh Kant, if you could come in now, it looks like, as Dr. Paul says, this vaccination drive really going to pick up huge momentum. But again, I want to ask about the timing of this starting now from Monday. There was a big push that had been given from the private sector. I think there was an urgent appeal from the Confederation of Indian Industry and other business luminaries. They had been warning, talking about a new disruption, perhaps economically, etc., unless private players are allowed to come help accelerate the rollout, because we can't afford to have another surge.
Sarah, we've administered over 1.2 crore doses. This means that we've been able to vaccinate about 1% of our population, and our vaccination is at about 110% of our total case load. Now, in a country as vast as India, the key is to build our capacity, leverage technology, and rely on partnerships to ramp up production, distribution, and vaccine administration. We were all through very clear that we will involve the private sector in a big way. We will use technology to scale up. If you look at our strategy, it was very necessary to take care of our frontline workers first, and at the same time ramp up production of, we have, as you are aware, we have 2 vaccines, but it's important to note that various other vaccines are also undergoing clinical trials in the country. And this includes Genova, Biological E, Zydus Cadila, and even Sputnik 5. And out of these, we should be proud that actually Genova, Bharat Biotech, and Zydus Cadila are all India-invented vaccines. And we are accelerating not merely the speed at which we will vaccinate our citizens, but also the speed at which vaccines will roll out over the next couple of months. It is important to realize that we should not do things in such a manner that we are not systematic about it, and on a later day, we either find vaccine reaching a parallel market or doing things in a manner by which we are not able to take care of our frontline workers and those suffering from comorbidity or over 60 years. We are all for private sector, and that's why the government has actually preponed this whole strategy of involving the private sector. So if you look at the overall strategy, it rests on 4 pillars. Firstly, vaccinate those at risk, healthcare and frontline, and those most vulnerable to it, the old and those with comorbidities. Secondly, help accelerate the development of more vaccines so that they can be brought quickly into the healthcare system. And, we are a great believer that there's no such thing as vaccine nationalism. We in India should actually be a provider of vaccines for the rest of the world. And thirdly, leverage private sector capabilities to the maximum to reach the vaccination drive and build capacity. And fourthly, establish a robust supply chain network, which would also aid us in managing any future pandemic. So I'm very confident that this combined effort of the government and the private sector will vaccinate all our citizens, as well as provide vaccines for many people across the world. And we are working to ensure this in a very time-bound manner, using the most robust systems and relying on partnerships where necessary. And in all this, technology will play a very, very key role in our overall success.
All right. So you talked about, of course, India has the luxury of so many vaccines, options of so many vaccines at our doorstep. Dr. Paul, before I move on to Ms. Mishra, I just want to ask you, does this mean, since we do have this luxury, we are going to see an expansion of the options of people to be able to pick for themselves which vaccine they would like to take? Are we likely to see Pfizer, which has shown interest entering India, Moderna, or there are some who feel that, or say that the current system, too controlled, too centralized, maybe too regulated, this drive, is that required when you have to reach out to every Indian across the land?
Sarah, let me answer the second part first. India welcomes entry of Pfizer and Moderna into India's market. India welcomes their vaccines to be studied in India if required. Typically, we perform bridging studies, which can be done rather quickly. So we welcome their entry into India, and Pfizer had actually applied and then withdrew the application. So the doors are always open, and there is absolutely no delay or any contrary message to these two particular vaccine manufacturers. Now, remember, we must keep in mind two aspects. One, that vaccines are only one of the 4 or 5 tools of pandemic control. The other tools have already worked in other nations, and they worked in our nation to bring the pandemic to a stable, controlled situation in a very big way. And when we take liberties with those tools, we get the resurgence of the pandemic. So vaccine is only one of the additional tools, and we must keep this in mind. No vaccine is perfect, and no vaccine is perfect forever. Every vaccine will have antibodies for a certain period of time. I think from this forum of exalted, very eminent people, we must see vaccines as one strategy, as a part of a package of strategies, as the WHO repeatedly reminds us in this regard. Having said that, remember, we are fortunate we have a huge capacity to manufacture vaccines. We are fortunate that we have capabilities to develop the vaccines, multiple vaccines. And other than these two, there are 7 other vaccines in different stages of clinical trial, phase 1, phase 2 going phase 3, 7 other. And in our laboratories, there are perhaps 10 others. So we have a huge pipeline. But also remember, putting together the total capacity going forward from the available manufacturers and also the ones who may get the license, such as Sputnik in the next month or so, and Kedla Zydus in another 2 or 3 months, and even others, it is not equal to 1.4 billion into 2 doses, right? It is not that kind of a number, and that's why prioritization is being done, and that should be respected. So we have a lot of vaccine for our people. We are also going to make some contribution in the spirit of our one world to other people, and that's a tightrope walk which is being taken by the government, and we are responsible for that. We are a big nation. We have a responsibility that we have to fulfill. So remember that the vaccine availability is huge, but it has to be used systematically. It has to be used for priority people. And as the vaccine availability rises, other options will open up. And therefore, to have in mind that there is unlimited supply of vaccines is actually not true. And we therefore have to go in a stepwise manner. We have done very well, and we will protect the vulnerable going forward in a matter of months. Then other options will open up. And of course, we will continue to be mindful of the 4 other strategies, namely the COVID appropriate behavior, namely testing, namely treatment of those who need therapy, and also namely contact tracing and quarantine and isolation and containment. So these 5 strategies will work together to extinguish this pandemic from the face of India.
All right, but Amitabh Kant, if you can just specifically answer that, about whether Indians should have the choice of what vaccine they would like to take. You've been a proponent of the private sector enterprise or personal choice. I'm sure you've been seeing those WhatsApp forwards doing the rounds of COVIDcations, fly to Dubai, 4-day package, etc. I just want to read out something that was written by a journalist in the FT, who's lived in India and reported on India since the 90s, and she says, I've been reminded of the socialist-style Raisins Raj days of the early 90s while watching the first phase of India's sluggish COVID-19 vaccine rollout, which began in mid-January. The article then, of course, goes on to say that it's a watershed moment now and the momentum's really going to pick up. But your response just to that bit, and whether you think if people have the option of paying for it, they should be allowed to choose what vaccine they'd like to take for themselves and for their loved ones.
Sarah, this quote from FT that you quoted right now, it's very easy to write an article in FT, but very difficult to deliver a massive program of this nature in a very, very large country, which has a population of 1.4 billion. And therefore, the government has a very clear strategy. It is working on it. And my view is that I think we should allow patience as a virtue. This announcement has been made yesterday. The government is working out a strategy on how private vaccination will be priced, what kind of choices will be available, what will be the time limits, how the partnership will work out. And I think we should wait a little bit for this announcement to come out very clearly.
All right. Okay. Mr. Mishra, there have been some eyebrows raised about the fact that India is exporting vaccines to 30 countries, which is a huge milestone. Even as the pace of domestic inoculation has crawled in this first step, it will pick up now. But the positives, perhaps, I don't know if you can call it a positive, is that the pandemic is a global phenomena. And from this, we have understood that this is an interconnected world, and perhaps you need global solutions to these global phenomena. Climate change, fortunately or unfortunately, also requires a coordinated global action. Do you think this pandemic is the push that was needed to lead to a global, united global fight against climate change?
Yes, Sarah, can you hear me? I guess what you're saying is correct. Whether it is a response to the pandemic or it's a response to climate change, has to be a coordinated response, because everything that happens in climate change ultimately impacts health and health structures. So, and one of the learnings of the pandemics has been that if you don't fiddle around with nature too much, your losses are limited. So with this learning, if we move ahead, it is got to be a global coordinated response. I hope the 26th COP discusses this, comes out with a strategy. Unfortunately, in all our global discussions on climate change, the linkage between health and climate change has always been mentioned, but never been prioritized. I think it's time that we started thinking as a global community that this must come top of our minds. And as far as the virus itself is concerned, I mean, the very fact that we have been struggling globally without any geographical limit should tell us that it's not one country or the other. Each one will have to step out of its own geographical limitation to reach out to others. And same with vaccination. I mean, yes, India will ultimately export. We have the capacity, so we'll export. Of course, the priority always will will be your own people first. But at the same time, there are global commitments. There are relationships with other countries, so the exports will happen. So at the end of the day, it is got to be a coordinated global response.
Amitabh Kant, would you agree? Have we addressed the links between the environment, between pollution, between our consumption patterns and climate change and the pandemic?
Sarah, I don't, to be honest with you, I don't think this has been done as yet, but there are very clear linkages between pandemic, climate change. We've taken a vast range of measures on climate change. In fact, we are the #1 achiever as far as our commitment to the Paris Summit goes. In fact, we are way ahead of other countries, unlike most of the developed countries. The Prime Minister has accelerated the targets there from 175 gigawatt to 450 gigawatt. And as you are aware, this particular budget talks about now a new mission for green hydrogen. This is all work towards a better future for as far as climate change is concerned. And as far as the pandemic is concerned, if you look at the statistics, you would notice that roughly 80% of deaths actually occurred in those who were above 50 years of age. And 67% of those who died had serious comorbidities. And therefore, it's very important to understand that what happens, if you have a bad pollution, if you have a city where you are constantly polluted, you are not able to cycle, you are not able to walk, this will lead to very severe health hazards and this will lead to severe comorbidities. And therefore, there is a very, very close direct correlationship between health and pandemics. And secondly, as what C.K. Mishra rightly said, the less you tamper with nature, the better it is. Because the more you tamper, the more harm and the more damage you will do for future generations. And therefore, it's very critical that we should keep the pressure of a vast amount of our population on as limited as possible, and so that we ensure a better living for our future generations.
But Mr. Mishra, there's a fallout. There are many fallouts of this pandemic. Fallout on the education sector, fallout on the environment. We've seen, for example, just so much consumption of plastic in terms of protection for oneself. We've seen a huge increase in that. As an environmentalist, as someone responsible for the environment, our forests, etc., have we taken our most pressing short-term problem and created an environment where it's going to be harder to address these long-term problems? Have we lost a decade of gains made in the fight against climate change, the fight against the use of single-use plastics, etc.?
Let me be honest, Sarah, and let me combine my two hats as Secretary Environment and Secretary Health and try and answer this question. We've started late. Let us admit that. We may not have lost a decade, but we've lost valuable time. Whether it is plastics, we started very seriously only in 2018. If it is climate change, Paris was the one that kickstarted everything, including the action in India. But also please remember that we are a country with the lowest per capita emission, among the lowest per capita emission among the large countries. So we need to tighten our belts, pull up our socks and try and see that the time that we have lost is regained. And that's possible. And as far as the pandemic is concerned, nature has had a role to play. And now post-pandemic, I think the most critical thing that has been discussed, which Dr. Paul and Mr. Amitabh Kant have been mentioning and you mentioned, is the vaccination part. And we should not lose time here. That is the critical lesson. India, in the past, has been one of the most successful examples of universal immunization programs. We've done a huge amount of immunization, which no other country in the world has done, and done it very successfully. I had the fortune of, rolling out the mission Indradhanush and conceiving it, and we actually managed to reach. So my only message on vaccination is that we need to sit back and learn from what we have already done, both from the mistakes as well as the successes. We don't seem to be doing that very well. We need to get back to that. And second, we need to rely on our systems. They have worked in the past for us. They will work for us now. Health and delivery of health is not, and I don't think it can be, equal to technology. There is far more than technology that needs to go in. It's a systemic intervention from the lowest to the highest level technology plays a very, very critical role, but over dependence and over interference of technology may at times start hampering healthcare systems. Let the natural process of preventive promotive health and the kind we have built in health infrastructure, let them take over. And I think together with the private sector, we have the capacity to actually move much faster than what we have done today. And I would like to slightly differ with the other speakers today. In the first phase, I thought we would do much better than what we have done.
Well, we have to now catch up then. It's a long race, and maybe you reserve your energies, as Dr. Paul says. But I think you've touched upon a very important aspect, which is technology and the role of technology. So, Dr. Paul, I want to ask you this question as a doctor, and then maybe Amitabh Kant can come in. Dr. Paul, again, a quote that I read in the paper today morning said that, let me just see if I can find it here. To begin with, the population that is eligible to take the vaccine will have to download the Arogya Setu app. There will be an option under the COVID section where they can register and book an appointment for vaccination, said a senior government official privy to the matter, not wanting to be named. This was quoted in one of the papers this morning. And is this, doctor, seriously, as a doctor, is this to tech savvy for a country possibly on the brink of a second wave? Do you think it's better to maybe, just open things up, make it walk in, as opposed to have to get an appointment, then you don't show up, waste of medicine, we're told, the vaccination dose, then waste of healthcare personnel who have been put on duty that day, perhaps at the cost of other immunization programs in the country?
Sarah, we are going through a phase where there are many factors at the same time. Now, let's take this scenario of walk-in. Walk-in assumes that when we all walk in, all of us, the place where we go, there are enough vaccines on that day. So if 100 of us have gone there, 100, and tomorrow 933 go there, that kind of a supply situation, please understand, does not exist today. So there has to be a balance. Yes, if we have leftovers, people should use the last drop of that vaccine. At the same time, there has to be some sense of planning, because it is not that the shelves are filled up with, even in the biggest hospital, AIIMS or tomorrow Apollo Hospital. So there has to be some way of knowing who all are going to receive services. I want us to please appreciate this part, which actually has been lost, in the discussion. And I want to return to 3 or 4 points that come up again and again, and you also raise 1 or 2 of them. Firstly, you use the word crawl. When we are the first to do 8 million, and now we are the second to do 10 million plus, why are you calling it a crawl, by the way? Is it a crawl? Compared to whom? There is no competition.
Population of India.
Population of India we will cover. Please understand, it is because rich people are not going into the market and getting this narrative. We have to look after the people, everybody. We have defined the criteria. So give us time, please. And therefore, this is not a crawl. I object to this with most humble, submission. This is not a crawl. We should be proud. Imagine this is happening in a country as diverse as India, and it is happening in the remotest of the corners of India. It is happening even today with the help of the private sector. 2,000 vaccination sites on a daily basis out of the 10,000 are private sector. Private sector was always involved. So that's the first one. Second, the choice, which I could not answer. Now I would answer. Remember, nowhere in the world today there is a choice for the recipient to choose the vaccine he or she wants. Okay. Why? Because it is a supply demand mismatch. Please appreciate, this audience today must appreciate that there is a mismatch. The supplies are not enough for all the potential people who should receive the vaccine today, and therefore they are being apportioned. Nowhere in the world you can walk into the market and pick up the vaccine of your choice and take the vaccine. Why? Even in the best of the countries, in the most democratic of the countries, because the supplies are being handled like a precious commodity to be channelized to people who need it most. So this is a scenario where we are today. 2 months from now, the situation can change. It is possible, and India can perhaps show you that we have other choices of the vaccine. They'll come. All these rules can be revisited. But today we have to remain focused and there is no moving target. The target is fixed. Vaccinate every Indian who is at risk to begin with, and every Indian who is required to be vaccinated to break the chain of transmission. My third point, remember, there is no vaccine getting wasted because of expiry date issue. Wrong narrative. Absolutely wrong narrative. I monitor how these things are going with my colleagues. Last, maximum utilization of the total production of the vaccine in India will take place. Maximum possible. If tomorrow the supplies are huge, there will be a further way of scaling it up. So please appreciate that a systematic approach is being taken. And I think I request that we seek cooperation and we request some kind of encouragement for people who are trying to mount the world's biggest mission in vaccination. Thank you.
Sure, and India can hopefully become a role model on how to vaccinate 1 billion people at a scale, speed, and in a trusted manner. I have some questions coming in since you've talked about one of the challenges that we face is also false narratives maybe being reported. So let me ask you a question, Doctor. This is for you. Fahima asks, reports are being shared on media that some have lost their lives after taking a vaccine in some parts of the country. How far is this true? How will this influence the process of convincing people to take the vaccine? I'm asking this question first because this is extremely important, because we need all Indians to not have any reluctance or resistance to take the vaccine. So Dr. Paul, could you answer her question?
Very quickly, Sarah. Let me say that the experience of 1.23 crore people being given the vaccine has shown one thing for sure, that both these vaccines are phenomenally safe. Perhaps among the very safest in the history of medical science. In terms of just any adverse effect, what the proportion is 0.05. One individual out of 2,000 who receives the vaccine gets a little pain and a little headache and a little, discomfort. 1 out of 2,000. Hardly any other vaccine in the past would have this kind of a safety profile. No death attributable to any vaccine till date. Wrong narrative. Hardly any hospitalization. There is one hospitalization a day or something as low as that, and even lower than that. So please appreciate these are very, very, very safe vaccines. And the experience of 1.23 crore people having been vaccinated confirms that. And therefore, I plead with all the people who are listening, please embrace these vaccines. You are doing it not only for yourself to save you and your family, but also you then become a block in the chain of transmission. The virus does not pass through you to others, and that's your societal responsibility. So we have twin responsibility to fill up. Thank you.
That's right. Okay, let me take a few more questions. Akansha Mishra has a question for Amitabh Kant. She asked, Mr. Kant, what is your opinion on the whole coronel fiasco?
Well, I would say that this is something which has been developed by one individual company, and we should leave it at that. The government has recognized 2 vaccines right now. It is looking at more innovation, which is taking place right now, and we should look at what the government has recommended for vaccination, which is, I think we should just go by what the government recommendations are and not look at what individuals have done. That has not been the government policy.
All right. Mr. Mishra, while we wait for more questions to come in, I want to ask you, again, we talk about the fallout of this pandemic on other sectors, like on the economy, on education, certainly a huge impact there in terms of our goal to educate each and every Indian, and also on the healthcare sector. Has the focus, rightly so, perhaps we needed to fight on the front line against coronavirus first, has that affected our other health development goals?
See, let me be very clear on this, that the pandemic is an extraordinary situation, and India in fact has done extremely well on first arresting it to the extent it could, then finding solutions in the hospital, and now in the vaccines. Having said that, there is a natural thing that will happen when, with limited manpower and resources, you are tackling such a large scale pandemic, that some aspects of routine healthcare, education, etc. will fall back. Having said that, if you look at the plans that are now coming forward from different departments of the government, the government is conscious and there is a plan to make up. As we improve, as we go along, as the pandemic recedes, or whichever way you want to put it, there is a concrete plan and it happens. Let me just give you an example of the environment. You know, when we had the pandemic and the lockdown was on, you all saw clear blue skies and everybody said, well, this is it. Now, I'm a person who said, no, this is not it, for the simple reason that it's come at a cost which humankind should not be affording ever again. The cost of the pandemic is not a small cost. But what it teaches you is that if you stay away, you will have blue skies. At least you got that message. So there are now programs and initiatives being built around that. So each of these aspects has suffered a setback, will definitely have some kind of an impact. But as long as you have a plan in place to pull it back together and get restarted, I think we should not get unduly worried about it.
All right. We have a question from Akansha Ari, and I think it's an important question because it's on many people's minds about costs. She's asked, Amitabh Kant, first to you, and maybe I'm going to ask all our panelists to talk about this. Dr. Paul, perhaps to you first. It says, the question is the private sector going to have some sort of guidelines in accordance to the rates of COVID vaccines, or will the situation be the same as it was during the testing of COVID when the private sector triggered the rate list on a high scale according to their own? Amitabh Kant,
so my belief is that when it is announced, there will be certain guidelines around this, but it's very important to involve the private sector. It's also important to realize that the private sector is not here for just charity. It must get a return on this. But as you accelerate the process of vaccination in India, the sheer volumes of vaccination across India will make the prices fall. And a good example of this was the testing, which started at very high rates, fell very substantially as the numbers increased. And simultaneously, you will see a number of new vaccines coming in, and therefore prices will over a period of time fall down very sharply.
Dr. Paul, what do you think the vaccine should be priced at? Sanjoy introduced this panel talking about how we're up against a moving target, right? It's a race against time for India to build up immunity amongst its population faster than virus can spread amongst its population. Amitabh Kant says, as the volumes increase, as we start vaccinating more and more, prices will come down. But is that the priority right now? Is the priority to vaccinate as many as we can right now, and for that, does the price need to be low?
Well, I think you should first look at what the government has already clarified, that if you go to a private sector facility for vaccination, you will have to pay some fee. If you go to government, you will get it free, and that itself is a big decision. Yes. Because going to the government, it is in a way universal, not confined to any particular, card-based or NFSA-based and so on. So it's a big decision already. The government is working on what that fee should be when you go to the private sector and what parameters that fee should be based on. I would urge all of us that we wait for the clarification from the government pretty much in time for the 1st March, escalated rollout. So just wait for those details to come up.
Mr. Mishra, how does the government be in, right? How do you decide on, because again, as this topic says, we're up against a moving target. We have the discovery of mutated variants that have been announced by the government just this week that further threatens our grip make, and the numbers receded to the lowest levels a fortnight ago. Now we have numbers rising. We're going to be carrying out this mammoth exercise, the largest part of vaccinating everyone at a time when cases are rising. So at some levels, maybe, I mean, you don't want to catch the virus while in line to get a vaccination, right?
Sorry, Sarah, I missed out most of what you said, but what I could gather was that you're trying to say in this entire exercise, there should not be a long queue that you miss it out. Is that what you're trying to say?
It's a race against time to vaccinate as many as we can. And how does the government decide on pricing?
It certainly is. And pricing is an issue where government will have to carefully decide based on what cost of production and the quantum of production is. And like Mr. Amitabh Kant was saying, historically we have seen that a vaccine which comes to India alone, the moment India rolls out a vaccine in a universal immunization program, globally the prices have fallen, whether it is pentavalent or any other vaccine.
Right.
So it's also about volume. So as you go along, as Dr. Paul was explaining, and the numbers keep rising, prices will itself start getting stabilized, not just in India, but globally, and they're bound to fall as the volumes rise. However, the production units need to be ensured that they will be given whatever is due, and that the government will ensure and is trying to ensure that. As far as the private sector conversation is concerned, A, they are required because their capacities need to be merged with the public capacity. B, they also need to be paid for because they are investing in it. But the C is also very true, that we need to very carefully look that an Indian citizen who's going to the private sector knows what he's paying for and why is he paying for. So that narrative will have to be built very, very carefully based on whatever government decision is on how much a person pays in a private sector. Currently, I think we need to concentrate in the government sector on the vulnerables and keep doing that more and more, while others who can afford can go to the private sector and get.
All right, we're out of time, but I want to just give closing words, closing arguments, a minute each to each of you, in the context that Indians seem to have forgotten that we are going through a pandemic. What do our authorities, what role does everyone have to play to make people go back to the basics, whether it's wearing a mask, whether it's washing your hands, whether it's just basically not hanging out in large groups? Mr. Mishra.
Sarah, we are not yet out of the pandemic, but I think majority of the people are losing the script now. And I think that it is time that everyone, not just government, it's not just government's business alone, everyone, whether it is the press, the media, the people, the intellectuals, whoever, need to come together to convince people to follow all norms. We're still not out of it, and people must understand that merely decreasing numbers do not end in pandemic.
Amitabh Kant, what's the solution? Because the government has opened up the economy, rightly so, as it needs to. Livelihoods are important. But what is the solution now going forward?
So government has opened up the economy for the sake of for ensuring lives and livelihood. But the government has all along insisted that everyone must wear a mask, everyone must maintain physical distancing, everyone must use Arogya Setu and maintain all the discipline of living in a pandemic age. And I think it's incumbent upon every citizen of India to ensure that we do not have a lapse back, as has happened in many European countries. India has done extremely well in both fatalities and the incidents, and we must live a very, very disciplined life. Every single Indian must live a very disciplined life so that India does not have a second or a third wave.
All right, but Dr. Paul, nobody seems to be listening, and at the front line, most susceptible, most vulnerable are healthcare workers and doctors like you. 30 seconds, sir, your message to our viewers.
Well, wear mask, because ultimately it's your protection, and you're also then breaking the chain of transmission. Second, embrace the vaccine, throw away hesitancy. And our slowness, the so-called slowness in the initial phase, was not due to the arrangements that were not being made. It was that hesitancy. I urge all of us to be agents of helping to put away hesitancy, embrace the vaccine, and be a part of controlling this pandemic.
Be a part of history. Thank you so much. Thank you all for your time today, and apologies to those whose questions I couldn't get around to, but it was a pleasure to have you on and have this discussion, this conversation. Bye-bye.
Thank you.
Thank you, Amitabh Kant. Thank you, Vinod Paul, C.K. Mishra, Sarah Jacob, for this brilliant session. You're absolutely right. This coronavirus is such a moving target in so many different ways. But what I think is absolutely vital is our success, both in terms of being able to contain the numbers of those infected, and of course, this incredible effort to be able to take the vaccine out to all of those inaccessible places that we are known famous for. We'd like to thank our celebration partners, Diageo. Thank you all for watching, being such a great audience. Remember to stay logged on. You can go on to the bar hall or stay on here at the front lawn to watch the next session. As you're aware, we are really stressed for resources. You can imagine the kind of money and resources we've needed to be able to get this on air for all of you. If you can, please do help us by contributing to Teamwork Arts. You can also tweet on our hashtag, the Jaipur Literature Festival 2021, and of course, our handle is at Jaipur Litfest. The festival and all of us are lucky to be protected by Dettol. See you in the next session.